Hello and welcome to the channel. Today we're diving into a topic that's both misunderstood and under-discussed: chest pain in young people. If you've ever felt pain, tightness, pressure, or discomfort in your chest, and you're under the age of 40, you might have brushed it off as stress, muscle strain, or just anxiety. But should you ignore it? Could it be something more serious? Let's find out. 1. Heart disease isn't just for the elderly. Anymore, let's start by clearing up a myth. Heart problems only happen to old people. This simply isn't true anymore. In the last 2 decades, doctors have seen a major shift. Young adults, people in their 20s, 30s, even late teens, are experiencing symptoms of cardiovascular disease earlier than ever. Why is that? We live in a different world today. Fast food and sugary drinks are the norm. Daily stress levels are higher than ever. Most of us sit for 8 to 10 hours a day. Social media and smartphones interfere with quality sleep. Many skip doctor visits even when symptoms appear. These factors all contribute to something dangerous: early onset heart disease. 2. What does heart-related chest pain actually feel like? When most people think of a heart attack, they picture someone clutching their chest in agony. But in real life, it can be more subtle. In young people, especially women, heart-related chest pain may present differently. Here are some common characteristics: a tight, squeezing, or pressure-like pain in the center or left side of the chest. Pain that spreads to the shoulder, arm, neck, or jaw. Pain that occurs during physical activity or emotional stress and goes away with rest, shortness of breath, fatigue, sweating, or nausea. A feeling of heaviness or unease in the chest that's hard to explain. You might not collapse and it might not be dramatic, but if the symptoms return, worsen, or feel wrong, it's time to get checked. 3. Not all chest pain is cardiac, but that doesn't mean it's safe to ignore. Now here's the other side of the story. Not all chest pain is caused by the heart. In fact, in younger adults, most cases turn out to be non-cardiac. That's good news, but only if you rule out serious issues first. Let's break down the most common non-cardiac causes of chest pain in young people. A. Muscle strain. A pulled chest muscle from the gym, sports, or bad posture can cause localized pain. It often gets worse when pressing on the area or moving. B. Costochondritis. This is an inflammation of the cartilage connecting the ribs to the breastbone. It can mimic heart pain but is usually harmless. C. Acid reflux, GERD. Stomach acid flowing back into the esophagus can create a burning sensation in the chest, often after meals or when lying down. ED. Panic attacks or anxiety. Surprisingly, anxiety attacks can mimic heart attacks. You may experience rapid heartbeat, tight chest, dizziness, or numbness in the limbs. E. Lung conditions like asthma, pneumonia, or even a small lung collapse, pneumothorax, can cause sharp, stabbing chest pain. So while the cause might not be your heart, that doesn't mean it's okay to self-diagnose. Only proper medical evaluation can rule out serious issues. 4. When to be seriously concerned. Red flags you should never ignore. Now let's talk about danger signs. If you experience any of these, get medical help immediately. Pain that comes on during exertion or exercise and goes away with rest, chest pain that wakes you up at night. Sudden unexplained shortness of breath. Chest discomfort paired with dizziness, nausea, or sweating. Family history of early heart disease or sudden death. Fast or irregular heartbeat that doesn't calm down. Known risk factors: high blood pressure, high cholesterol, diabetes, smoking, obesity. Even if you're only 25 or 30, these signs matter. 5. What tests will doctors run if you report chest pain? If you go to a doctor or emergency room with chest pain, don't be surprised if they take it very seriously, especially if you're young. They may perform electrocardiogram, ECG, checks for abnormal rhythms or signs of a heart attack, troponin blood test, detects heart damage, chest X-ray, helps rule out lung problems. Echocardiogram uses ultrasound to look at heart structure and function. Stress test tests heart function under physical stress, CT scan, or angiogram, in rare cases to look at coronary arteries. Doctors don't want to miss anything, and neither should you. 6. Lifestyle factors that increase your risk, even in your 20s. So how does a 28-year-old who seems healthy end up with heart-related symptoms? It usually comes down to lifestyle and genetics. Ask yourself, do you smoke or vape? Do you drink energy drinks or use stimulants? Do you eat processed or fast food daily? Do you sit for long hours with no exercise? Are you under chronic stress without proper rest? Do you have a family history of early heart disease? Even one yes could put you at higher risk. The scariest part? Many people feel completely fine until they don't. Sudden cardiac events in young people are increasing and often linked to preventable factors. 7. Prevention is the real cure. Start now. You don't need to wait for chest pain to start fixing your habits. Here's what you can start doing today. 30 minutes of exercise a day. Even a brisk walk counts. Switch soda and energy drinks for water. Cook more at home with simple, whole ingredients. Quit smoking and vaping. No excuses. Sleep at least 7 to 8 hours per night. Manage stress through deep breathing, nature, music, or therapy. Track your blood pressure and cholesterol yearly. Think of it like this. Every small change you make today prevents a big problem tomorrow. 8. The psychological side, when anxiety mimics illness. Many young people experience chest pain that turns out to be caused by anxiety or panic attacks. That doesn't mean it's all in your head. It simply means your nervous system is in overdrive. Chronic stress, lack of rest, and emotional trauma can cause real physical symptoms, including rapid heartbeat, shallow breathing, chest tightness or pressure, tingling or numbness, dizziness or fear of dying. If your tests are normal but symptoms persist, it may be time to address mental health too. Anxiety is treatable, and so is the pain it causes. 9. Real-life examples. This happens more than you think. Here are just a few real-life stories. A 27-year-old marathon runner who had a minor heart attack due to an undiagnosed congenital defect. A 24-year-old student who ignored chest pain for a month. It turned out to be early myocarditis. A 19-year-old who experienced panic-induced chest pain that mimicked heart symptoms during final exams. These aren't extreme cases anymore. They're becoming part of the new normal. Don't be part of the statistic. Be the exception by listening to your body early. Conclusion: you're young, but not invincible. Chest pain at a young age doesn't mean your life is in danger, but it does mean your body is asking for your attention. Whether it's your heart, your lungs, your stomach, or your stress levels, every symptom is a signal. Don't silence it. See a doctor. Get the right tests. Fix what needs fixing. And most importantly, don't wait for the pain to get worse before you take action. Thank you for watching. If you found this video helpful, consider subscribing for more content on health, wellness, and living a longer, better life. Take care and take control of your health today.